Hello, everyone. Dr. Anna Cabeca here, and welcome back to the Girlfriend Doctor Show. We're going to talk about vaginal health and vaginal restoration. One of the big issues that we see is issues with vaginal dryness, uh, vulvar discomfort, loss of sensation, decrease in orgasm, and that is not something we have to live with. I think what's really important to understand is, and I've heard many women say, "Well, I just power through." For my partner. I just power through the discomfort. I just, that's on my to-do list, so for the sake of my relationship, that's intercourse or intimacy and sexual issues or sexual connection is just something on the to-do list and not really part of the desire. There's no desire there. And so I had a client in my office recently, and she said, Dr. Ann, I'm fine when we get started. I just never feel the urge to initiate sex. And so I will say it comes down to three main things. And the three main things come to issues of desire. And there can be there's 7 areas that relate to this, but issues of desire, issues of disconnecting with the partner in our relationship, and discomfort. If it hurts every time we do something, why would we want to? Now, over the past really 15 years, there's been a surge of vaginal rejuvenation procedures, advertised labioplasty, vulvoplasty procedures, clitoral injections, G-spot injections, and these things to increase intimacy and sexual health and intercourse. And I want to talk about this today. This is, when we look at med spas and cosmetic procedures. Now, I had a med spa way back in Brunswick, Georgia, and St. Simon's Island for many years. And part of that med spa was doing cosmetic procedures. I had an aesthetic medicine physician. She was a physician board certified in aesthetic medicine, and she would come every 2 weeks and do procedures, every 1 to 2 weeks, and do procedures, laser procedures, etc. I did vulvar rejuvenation or G-spot. I did G-spot injections, and my vulvar rejuvenation encompassed red light therapy and hormonal therapy. And that was part of my practice. And this is, really before we had vulvar vaginal laser procedures, radio frequency procedures that are now available. So I brought in today Angel Turlington, who is a registered nurse. She's been in women's healthcare since 1996. She is a graduate of East Carolina School of Nursing and holds a bachelor's degree in nursing and certified as a women's health nurse practitioner. She is a member of the American Academy of Anti-Aging, actually, where I connected with her recently. And she just has this incredible passion for women's health, especially that we show up as good as we feel and we feel as good as we look. Now, they are two different entities, as we'll talk about. They're two different entities, but understanding that there's the combination. It's not just how you look on the outside, it is how you feel on the inside and how that radiates, especially when it comes to health and maintaining your optimal health. And I think it's an area of incredible importance to so many of us that we look and feel great. And so I brought in Angel today to talk with you, as she has been in the aesthetic medicine world also for over 15 years, and has been working with injections, sculpting procedures, laser procedures, radio frequency procedures, etc. We're going to focus on vulvovaginal rejuvenation because, again, it's an issue of controversy and for many people, but again, very, very important. And it could be something that you've thought about, have had done, and have questions about. So we're here to answer those questions today. So first and foremost, I want to welcome Angel to the Girlfriend Doctor Show.
Thank you, Dr. Anna. It's a pleasure to be here with you today. I'm looking forward to our talk.
Me too. Me too. Well, give us some background. How did you get interested in going into the advanced training at A4M and the aesthetic side of medicine?
Well, aesthetics was sort of something I stumbled into. I didn't even understand really this paradigm or this option, because this was in 2005 when we only had two FDA products available, which was, well, we had collagen, but we had the big ones that we still have today are Botox and Restylane. So, it was very new, and I'm in a small town similar to you. So, and I was 32. So it was kind of like, what's all that stuff, and it's been a wild ride. I think I'm pushing 19 years now, in on that ride. And so, of course, now we have, probably almost 20 FDA approved facial fillers, and we now have 5 wrinkle relaxers. And it's a lot, and it's a lot for new incoming medical professionals to learn. And I've just been lucky enough to sort of grow up in that space. And I came out of an OBGYN practice, which I owned with my then husband. And we both had a very strong passion for women. We met as I was a labor and delivery nurse. And it just, as life would have it, it started to become a burden for me to see my medical patients and see my aesthetic patients. So I just sort of went on that journey, because it's where my heart told me that I could serve patients in a different way. And it's just the full circle that has come around back to then now hormones and biohacking and wellness has just, it's just been a real blessing to have been in the place that I'm at the various ages.
Well, I love it. And especially, I know that labor and delivery nurses are the most gifted and kind people, really. I mean, I couldn't have seriously do OBGYN without the amazing labor and delivery nurses. And especially as a young resident when I was at at Grady Hospital in Atlanta, where I trained, those labor and delivery nurses trained me. I mean,
Yeah.
they had so much compassion and patience and knowledge. And I mean, and just even thinking about the little things like, drawing blood or putting an IV in a pregnant patient with preeclampsia is probably one of the most challenging things, but also being part of a woman's experience in childbirth. They're often someone I remember everyone that was in my
Yeah,
childbirth for sure.
absolutely.
And and it's so important to have that relationship, but also on that side of thing, in the obstetric side, looking at, late how childbirth affects vulvar and vaginal health. And I think this is really important because as a gynecologist, doing, first of all, doing many deliveries. And then while in residency, my first year in residency as an OBGYN, I delivered my own child. And she was over 8.5 pounds. I was in labor for 3 days. It was in 1996, Angel, and it was the Summer Olympics in Atlanta. And I
Oh,
was in labor in Piedmont Hospital. My water broke, and then there was the bomb scare. Do you remember the 1996 Olympic bomb scare?
yes, absolutely, in Atlanta, and absolutely, yes, I 100% remember that.
Right? And so they were
Yes.
evacuating everyone from the hospital except for those in active labor and intensive care that couldn't be moved.
Wow, and there a little cortisol for you there?
Little cortisol for me, this poor child of mine, right? Not only does she have to be the firstborn, and then at that time too, in labor, I actually, um, in delivering Amanda, my firstborn, I tore, and the OB, you know, I think didn't have enough downward pressure on Amanda's head, and I tore anteriorly. So
Mm.
along the urethra, all the way along the clitoris, that area. And I hurt for over a year. I had
Ugh,
pain there. And it just stuck with me so much, the concept of discomfort. And then also as an obstetrician, downward pressure, if I need to do an episiotomy to do it, but really to educate my patients in preparing the vagina and then repairing, if we have a tear or a laceration, or episiotomy, very, very carefully, because I have seen so many people that didn't get a good repair and have struggles with prolapse, have struggles with, um, weakness of the vaginal muscles, a thin perineal body, the muscle, that the area of tissue and muscle that separates the vaginal orifice from the anal orifice. And so that needs to be a nice, good muscular body. And so, thinking of those areas and being able to repair that if needed is really important. And having good tissue to repair with makes a difference. And I've known you've seen that as well.
Absolutely. And I think the thing is that no one can truly be prepared for what it feels like to have a baby hanging off your breast and a belly that in body that you can't put in your regular clothes, and then you can't sit down in a chair comfortably because you've had XYZ trauma, to the
Mhm.
perineum, and um
And we're supposed to just suck it up, by the
yeah.
way. We can't
Yeah.
complain. We've got this great baby and all that oxytocin going, but still, damn, I can remember that hurt. And then just even using the bathroom. And there's so much that we can do to prepare and to help us in that process now. But yet, yeah, so those are some memories there. Those are some memories.
Yeah, I've seen, and much like you, because I graduated from nursing school and about I think 1995. And we've gone through periods of next to no fetal monitoring, to optional C-sections, to now I think we've kind of in a happy medium there. But obstetricians, I was married to one for almost 20 years, and it's a hard job, and it's a thankless job a lot of times. And they people don't realize that you may be in a case in the OR and have to run out and catch a baby. That's why the labor and delivery nurses are so important. And
Right,
you may, uh, you as a whole can be in a bit of a hurry, and you sew up that laceration real quick, you accomplish the task, right?
right,
And we don't always know what the consequences of that repair may be, even whether it's done optimally or not.
right.
And again, sometimes I think there is, and again, you and I are similar in that we're from the South, and we're polite and we're quiet and we yes ma'am, and we don't really talk about our vaginas, or our vulvas. And certainly not to our friends. And and lots of times this especially
Taboo.
in well, and lots of times they're male physicians,
Right.
and that can be uncomfortable speak for some women. Yeah, I think that is something that is I used to teach childbirthing class, and that used to be part of my education. I was a doula. I was the whole thing. I wanted to be a midwife,
Ah,
but I chose my children, because we decided there would not be a way for there to be two people delivering babies, without having childcare in home. So but that part of I think of having an impact of education of women is a time that you can empower them, like as you were explaining, preparing the perineum, preparing for what you want your birth to look like, making that decision about what you'd want to do if everything goes perfect, and what you'd want to do if everything doesn't go perfect. and
right.
and and I don't know if they're writing birth plans anymore. Do you know?
Yeah, yeah, absolutely.
Okay, that's
Yeah,
wonderful.
still doing that, right? But
And
I think it's a good to plan and prepare and to have like understand alternate ways to labor and not
yes.
be in such a rush to schedule and deliver. But to each their own. We just know that natural process is so much more powerful. Now, Angel, the people should not feel bad about wanting vaginal rejuvenation, for not
No.
wanting to optimize vulvar and vaginal health. And I think like slowly through, really med spas and plastic surgeons and GYNs, et cetera, that are talking about vaginal rejuvenation technique. What have you seen shift in this concept when people come to you for vaginal rejuvenation, or, like to discuss that? What's the most common reason they want to do this?
It's very interesting. I have driven that conversation probably more than patients have, which I'm sad to say, but for all those reasons that we mentioned before, about their willingness to talk about these issues. When the devices first came out, there were three technologies. There was CO2, which is basically like a blowtorch. If you know anything about lasers, it's just all heat. And then there's laser, and then there's radio frequency. So when you're in aesthetics, not only do you understand lasers, but you understand what all the different wavelengths of lasers are capable of. And some are ablative and some are non-ablative. Some are, driven to look at hair for hair removal. Some are driven to ablate or remove tissue, just like we, do in the uterus with NovaSure. CO2 proved not to be really the best technology. Surprise, surprise.
Mm.
And so, but the ablative lasers, what they did is they made them fractionated, which is pretty standard now, even on the face. So
Mhm.
you don't completely ablate the epidermis, but you just put small columns of that ablative laser. And when you create that wound, you get a neocollagenesis.
Mhm.
And that is the theory. I've personally never had a vaginal laser rejuvenation procedure. I've heard that there is some discomfort in that, but it seems to be very mild and not enough for people to say that they would not repeat it. That third technology, we have lots of facial devices that use radio frequency in lots of different ways, if you will. But radio frequency is the only technology in aesthetics that you can say creates skin tightening. Now, I'm telling a story. We do have high frequency ultrasound now, and
Yes,
that is a
right.
skin tightening. But radio frequency has been around for a while, and
And
we have
very
thermage.
relatively very safe and
Yep, yep, yeah. We Thermage was one of the first brands on the face, and it was penetrating too deep, and that there was some negatives to that. But yeah, you're the you it would be a very mild burn, really would be the significance. But we've got, there's even on any of the technology PubMed, there's 50 plus studies that support the safety of vaginal laser rejuvenation and radio frequency rejuvenation. And we know that they improve all the things that come along with either potentially childbirth. Now, scar tissue, those sort of things, you're not going to get resolved from that. But genital urinary symptoms, the urine leakage, laxity, even sensation, have been something that people have really just
benefited
uh,
from for sure.
yeah, yeah. And it seems like once people get them, it almost becomes like their annual pap smear. It's like, I mean, they'll come back and go, oh, wait, summertime, it's gonna be my time. Like they feel like it is part of their anti-aging regime. So it's just it's it's bridging that knowledge gap, like everything, right?
Yep. And what's the most common reason that women are coming for the vaginal rejuvenation procedures
I
that
think
you've
that
seen?
one of the biggest ones, and I wish so much we could get better support from our OBGYNs and our oncologists, but a lot of it is, vaginal dryness and that mucosal frailty that comes with, postmenopausal tissue, and
Mhm.
they're maybe having dyspareunia, or they're, it's more some of a pain and lubrication issue.
Right.
Um, and
And breast cancer, history of breast
Exactly,
cancer. Yeah.
exactly. And those are the ones, even though, everyone has that different opinion, but a lot of us believe you can use vaginal estrogen even post cancer. But um
And vaginal DHEA and
yes.
topical DHEA, safety studies. There are plenty of safety studies looking at this in patients with history of breast cancer. I think that's critically important. So for sexual health, intimacy, comfort, bladder health, urogenital health, so incontinence issues, those are all exactly the reasons I see clients coming in for that as well. And the concept, and this is where our medical literature and the news media gets me aggravated sometimes. But we had headlines that said when was this? Just a few years back. Um, that said, well, an article was published in ACOG, American College of OBGYN's journal, and it said that while perimenopausal vulvar vaginal rejuvenation procedures can be beneficial, postmenopausal has not shown any preventative, protective, or beneficial effects. There are not enough significant improvement to warrant the procedure. And however, those were, you have to prime the vulvovaginal tissue and you have to be healthy on the inside. So let's talk about that. I know for me, it's of course like at least a couple months of using Julva, at least every day, additional vaginal hormone insertions, such as with vaginal testosterone and DHEA, or using Julva intravaginally as well for at least 2 months before the procedure. And then after the procedure to maintain results, because you've now improved you've turned these prohormones turn back the hands of time. So your the mucosal layer thickens and becomes more moist. The connective tissue underneath also improves and improves function with pelvic floor exercises, improves the strength and responsivity to the vaginal tissue, as well as your natural glandular secretions and an improvement in the vaginal pH. So all of those factors are necessary, before that procedure, but in general, with or without the procedure. And then, of course, to maintain results after a procedure. So that's definitely been my experience. And what about for you? How do you approach it? And especially because you have so much integrative medicine training with A4M.
Well, absolutely. I would actually even just go back to aesthetics, because you can't just come in and get a laser procedure and your skin stay looking healthy and young. It's all the things, right? So it would make perfect sense to prime the skin before any procedure, particularly a laser or say a rejuvenating procedure on any part of the body. And I think um, setting that mindset of people, that you're going to treat this just as you would the face, I think, is kind of cool. And I think that people just, again, maybe they don't see any big outstanding problems, and there's that class of people too, that it's like maybe they don't know what they're missing, you know,
Right.
um, on the positives. But yeah, I think there's no doubt the Julva is going to be sort of a centerpiece in these procedures, for me, always going forward, because I know that again, anyone can have that. It's not even prescription based, and I think that sets apart some of that fear and hesitation that you may have, that people that are uneducated about hormones. And then if you can deliver a better outcome, hopefully then that's gonna certainly cement that patient to you for that procedure again, and then maybe other aesthetic procedures and menopause support and all the things, right?
Yeah, yeah, no, absolutely. And again, beauty from the inside out. Now, I've chosen not to Botox, not to filler, not to anything at 58, letting my silver come through, and then it's to each its own without judgment. But I used to do those procedures in practice, and I just really felt that if I am able to get them healthy from the inside out, ideally, but there's only so far we can go, right? There's only so far we can go. And yet the individual's appreciation, self-actualization, and self-love has to come through with what what the results they want, what they're achieving, what we're doing on a daily basis. Like I didn't want to get up at 6 a.m. and work out, and I worked out with my trainer. I'm like, oh, I just love to stay in bed. But those are the things that we do on a daily basis so that we obtain optimal health. The other thing is how we're nourishing our body, how we're detoxing. I'm on day 2 of a water fast with my Magic Menopause community. So we're, like this is like, we do these hard things because we want results. We want to heal from the inside out and the outside in. And I think it's just important to to honor that and honor individual women's choices. There's no shaming here, right? There's no shaming here. And it's accepting what we can do, but also as naturally as possible. Because, especially with working with aesthetics, facial response, if someone has a bad diet, they're not going to get as good a response as someone who's really well nourished and
Yep. Yep.
low inflammation or no inflammation.
Well, and nutrition is feeding your skin from the inside out, no question. And I have practiced this lifestyle for the bulk of my career, and so that's the other reason I felt a responsibility to push women towards recognizing that this is all, there is a reason that I'm aging so well, and I can, and as far as appearance goes, and I say this all the time, and I can promise you, it's not Botox. You know, it's not. It's my diet. It's all of those other healthy habits that we do. I'm wearing a CGM right now just to kind of check back in where I am with that. And I'm doing these things to try to live that example. Now that's where I say again, where we're in that great space of wisdom and age and being hopefully more of those matriarchs with folks to show them that this is an entire lifestyle if you want to age well and you want to age with that health span piece, and that's where that comes in. And yeah, it can be challenging because some people don't want to do the work, or they just feel they just don't prioritize themselves, which is sad, honestly. Because no one else is going to give you permission to do you. That's the one thing I've known and learned from being a mom and a partner and a businesswoman and all those sort of things.
Yeah. Yeah. And also as we shift, as we shift and develop now going through menopause and the changes that, we have to address and deal with, it's like, there's a piece of accepting and honoring transition and transformation for the best of ourselves, our mission, our families, our purposes that we have in our life. And I think it's that honoring and never giving up, never saying like I'm too old or I can't do this because created mostly perceived boundaries and limitations on ourselves. So I'm going to swing back to vaginal and vulvar health, and you've been a big fan of Julva and Balance cream in your clinic, in your practice, and I would love for you to share results and how it's helped you and your patients, and why you're using it.
Well, I can say that one of the cute comments I got recently when I was referencing you in a conversation, the client said that she had used your Mighty Maca and she had loved Balance Cream, but Julva had made her fall in love with her vagina again.
I love that.
And she was, speaking in, this is, she's been using this now, I'm sure, for years. And so I don't think that, it's just a staple of her life. But yeah, I thought that was a really neat one. And we hope to hear more of those comments. I have been see, a lot of my patient population is still that perimenopause age. So, kids getting into high school, them having a little bit more time for themselves and this self discovery just in and of themselves as their children get a little bit farther from the nest. And so I have focused more heavily on the balance cream because, we know that the dosage is safe and low, and these perimenopausal women really are not tuned in yet. It's, I am having to say, I, everything you're telling me tells me you're progesterone deficient, and you're 40 years old, you're
That's the
42
first
years old.
hormone to really tank, but DHEA and then progesterone.
Exactly, exactly, and that is not on anybody's radar.
No.
It whatsoever. And I am, and I another comment that I didn't even think about till right now, but I've had people, again, small town, people around town telling me, "Oh, such and such is such she's using this cream and you just that gave her life back." because
Yeah.
she's sleeping so much better.
Yes.
And I said, "Oh, wow, yeah, that's really great. Like that's what this is all about. You need to talk to me more about this." And so those are the kind of things. I think it's probably peer to peer, woman to woman, where these things get shared, where it opens up that conversation. So I mean, as a matter of fact, I even had a husband come in the other day. The woman had had some sort of surgery. I believe it may have been cosmetic surgery, but it doesn't matter. And he bought 3 of them,
Oh,
of the
nice.
balance creams. Yes, she said, "While you're going in there, just get as much to hold me till I'm better and can come back." I
Uh,
loved it.
things we won't live without. I know I had
Right?
a friend of mine. He's like, I need a T-shirt that says my partner uses Julva. I'm just like, it's a good thing. And men are not like they want their partner, they want their wives, husbands want their wives to feel the best, want them to want sex, want them to have desire, want them to feel satisfied and pleasure.
I know.
And I think that's really important. Another guy said, I'd rather, I will give up buying my beer so that we can stay in stock with Jolva. And I just
Oh,
love
I
that
love it.
one. And I think it's like it's us when we're like feeling about even about again vulvar vaginal rejuvenation procedures, taking care of, I say clitoris to anus is the most important real estate of our body, is that it comes with no shame. This is part of taking care. God designed our bodies for pleasure. There's no shame in it. And so want to be able to address that and take care of take
Well,
care
and
of
and
every aspect of ourselves, head to toe, but especially an area that functionally is critically important for quality of life, bladder health, vaginal health, risk of, it just makes a big difference. Comfort,
it yes, yes. I mean, it just
sex.
makes you a happier person if if when in the old saying, "If mama ain't happy, nobody's happy."
That's right. That's
So,
right.
um, and I unfortunately, I've always cared for women as a women's health nurse practitioner, but I've certainly had plenty of couples in a treatment room. That's a time that you really do have the pair together, right? But it's a I envision that when a man speaks about some issues in the bedroom, it immediately goes to erection, and it immediately goes to a prescription, and there's not any conversation about desire, disconnect, discomfort,
Right.
physician to male patient, which is a shame. And I don't know how we can affect that change, but again, I guess we just keep talking, right, and hoping that there will be more conversation opened up on that end
Yeah,
of
and I
things
would say
too.
for every listener to share this episode with at least 2 people that they know. Definitely, again, just to have a conversation. The more we get comfortable saying it, the more comfortable we are. The more we get comfortable having the conversation, the less other women will have to suffer, especially if we've suffered. Again, I do what I do because I've been there. I've had I had the pain after childbirth for over a year. It just hurt. And to have sex was like being stabbed. It was terrible and took a lot to rehab that. And so now we have great pelvic floor physical therapist, and that should be part of our postpartum care for everyone. And if we don't have someone local we can work with, there's great virtual coaches that can help. And the other piece too is with incontinence after having 4 babies and dealing with that and reversing that non-surgically, dryness due to early menopause and menopause. I'm 58. So reversing that and naturally, restoratively, and that just makes all the difference in our lives. So not being afraid to bring this up and, to advocate for what we want for ourselves without judgment of what, someone else wants or doesn't think you should want. So I think it's powerful. Angel, tell our audience how they can get a hold of you and connect with you in person, follow you on Instagram.
Okay. My Instagram is at Southeast Med Angel, and I am very active on there. I've just started TikTok because someone told me to do that. So God help me, because that's beneath I've got a lot to learn. Um, but my business is Southeast Aesthetic and Wellness, and we are located in Clayton, North Carolina. And the social media is southeast.aesthetic.wellness. And I hope that people recognize that as far as the functional medicine and testing and wellness and nutrition and hormone advice that I can give them, I'm licensed to be able to speak to anyone in the state of North Carolina. And that's something that I think is also cool, is that you don't have to necessarily take the time to come in and see a provider, because we can, we can write these prescriptions, we can send these products through the mail, and we can also we can take that off the list, that that's not enough time, right, to take care of ourselves.
Right. 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 We would make time. And then again, I would always say too, there's nothing better than an in-person appointment, but when we can't get the right people in our immediate vicinities, then we have the world at our fingertips. So Angel, you've been an excellent resource. I love how you show up and the passion that you show up with and taking care of women's health and really and just walking the talk. I mean, you're a beautiful person inside and out. And it's just been a pleasure to know you and to, collaborate with you. And I just thank you. Thank you for sharing your time and your energy and your knowledge with our audience. And is there anything, I know we were like running through a list of things. I'm trying to remember. Is there anything we didn't cover that we wanted to cover last minute?
I don't think so. I wanted to tell you that I don't know if you remember how emotional I got when I first met you. And I still get choked up about it, because I had a very powerful female group, when I was a labor and delivery nurse, and I actually had all my children with midwives, even having an obstetrician for a dad.
Mhm.
My last baby was born outside of a hospital. Like, I'm kind of a
Wow.
rebel.
I love
Um,
it. I
but
delivered my grandbaby in a midwifery center in a
yeah, yeah, that's
house,
exactly what we did. It
and it
was
was the
wonderful.
best delivery of my life.
Yes, yes, that's what this was. We stopped by the grocery store 6 hours after he was born, and I didn't go in, but, grabbed some whatever and went home, and it was wonderful. But, you know, um, one of the things that I just feel like is also really important to say about yourself, and to say about some of the other, very powerful, knowledgeable female physicians in this space, is that there so many of us providers like myself need strong female mentors, because you empower us to then translate that down into our patient population. And I just wanted to thank you for being that person, because that's part of why I was drawn to you, because I realized that I worked under my husband, who was a man, sorry. And I haven't had that professional female role model. And you are very much that. And I just wanted to
Thank you.
thank you for that.
Wow, thank you. Thank you. You've warmed my heart, Angel. I appreciate you. Thank you so much.
Well,
Uh,
thank you for all that you do for all of us, really and
uh,
truly.
hmm, I just received that. Thank you. And
Yeah.
to all our listeners, thank you for listening. Thank you for sharing. Thank you for showing up for yourself and for others in your life. The time you spend taking care of you is selfless. It really is. It is not selfish. And if we have that perception, it is absolutely wrong. So I encourage you all to really embrace where you are in life and advocate for yourself and keep showing up. And as women, being able to mentor those around you, it's one of the greatest gifts. And certainly hearing Angel say this to me today is just has warmed my heart. And it again, it's hard work, makes it worth it. It really does, makes it worth it. So thank you all for being here. Share this episode, and I'll look forward to seeing you next time on the Girlfriend Doctor Show. Thank you.